Good afternoon, and thank you so much for joining our presentation today, addressing racism, implicit bias, and cultural competency in home visiting programs, assessing for and responding to community need. My name is Sharlene Gozalians, and I am the director of LA Best Babies Network at California Hospital, located in Los Angeles, California. And on this presentation today, we also have my colleagues, Martha Bock and Kayla Kakavand, our public health research associates, and our director of policy, Jana, Wright. Next slide, please. In today's presentation, we will be covering the background on home visiting in LA County, essentially a landscape. I'll also provide you some more background on LA Best Babies Network, which I will be referring to as LABBN. We'll be providing an overview of the consortium and the work that it has done in terms of addressing implicit bias, racism, and cultural competency, and also talking about our assessment and response system that we have integrating racism, implicit bias, and cultural competency into our home visiting work and network. Next slide, please. This is one of my favorite quotes. Some of our nation's costliest social problems, like child abuse and neglect, school failure, poverty, and unemployment and crime, are rooted in early development. Quality voluntary home visiting leads to fewer children in social welfare, mental health, and juvenile correction systems, with considerable cost savings for states. This is essentially the quote that built the work that we do today. When LA Best Babies Network started 15 plus years ago, it was all about better birth outcomes, which led us into the home visiting field back about 10, 12 years ago, and had multiple expansions over the time with various funding sources. But always coming back to this quote, knowing that if we're able to provide our families with a service that really holds them, that there's quality, that there's space to learn and fail and learn again, and that support system, we can actually stop the cycle of trauma and help families with self-efficacy, confidence, and just to feel better about themselves and be more resourceful and resilient. We know when it comes to LA County, we have about 116,000 births per year in LA County. Our infant death rate is about 4.4 per 1,000 live births. It's even higher for African-American families, 10.3 deaths per 1,000 live births. In 2019, 50% of students met or exceeded grade level standards in reading. In 2018, 17.8% of mothers received home visiting services. In 2017, 82% of women received prenatal care during their first trimester. However, even though it's 82% for our county average, the reality exists that depending on where you live in the county, that average could drop as low as 50%. In 2017, it was recorded 32% of primary caregivers had difficulty finding childcare for their children aged 0 to 5. And in 2017, 57% of children 0 to 5 years old were read to by a parent or family member daily. We've come a long way, but we also still have a lot of work to do. And the goal of home visiting is to increase the protective factors for families, their ability to manage stress, have positive relationships and social connections, understand child development and role in supporting their child's growth, providing positive environment for their child, and having access to concrete supports in times of need. Next slide, please. Now, I know we all know what home visiting is, but just for the sake of making sure we're all in the same field, when we're talking about home visiting in LA County, this is what we're referring to. Home visiting services are voluntary and free. They are meant for the whole family, not just for the program child or the primary caregiver. Generally, they're conducted by trained professionals. Depending on the model, there's different requirements and definitely a standardized set of trainings that they must go through before starting to see clients. It includes referrals and resources to other services in the community, almost like a triaging center. So the idea isn't that the home visitor is the know-all, end-all for the client, but they're able to send them to different resources and give them access to other caregivers, multidisciplinary support services to help the family overall. And these home visiting services, especially during COVID, are now more than ever virtual and on the phone. But we still definitely have some home visiting services that are in-home as well for our clients who need it most. The goals include preventing child abuse and neglect, ensuring a healthy child development, improving child and parent mental health, increasing family self-sufficiency and self-efficacy, decreasing criminal involvement and need for special education, education and enhancement of certain desired outcomes and goals, and minimizing and preventing families entering crisis system. Essentially, we're trying to stop the cycle of trauma and cycle of abuse. We know that many of the families that we work with have been through their own trauma as children as well, but how do we stop that cycle from repeating? And how do we empower those parents to feel confident and to give them the resources to do the best they can for their own family, to be able to parent their child the way they want to parent their child, not out of necessity. Next slide, please. This is a very cool infographic that the data work group created through the consortium. And you'll hear more about the consortium in a little bit from my colleague, Jana. Essentially, this infographic gives you a sense of what LA County's home visiting needs and capacity are. In general, home visiting programs fall into one of two categories: targeted programs and universal programs. Universal programs are voluntary programs offered to all families living in the community, regardless of risk factors or socioeconomic status. They focus on things such as primary prevention, educational and screening services, and linkages to community resources. Our targeted programs provide more intensive interventions and specialized services based on the family's specific risk factors. Programs may be court mandated, recommended based on behavioral or developmental or infant mental health diagnosis, or voluntary for families with specific risk factors. You'll notice, and the thing I want to draw your attention to is, in general, the number of home visiting slots that we had funded in 2020 was 33,684. However, when you look at the needs of our families age 0 to 5, you'll notice that need is over 865,000. I do want to point out, as you look into the data on the left-hand side, there's various risk factors that are noted there. These risk factors are not mutually exclusive, so there is duplication. But we do estimate that each year in the county, there's nearly 750,000 children up to age 5 that are eligible for home visiting services. But because we only nearly have 34,000 spots available, there's only about 5% of those who are in need getting services, which leaves 95% of our families and children without this home visiting service. Next slide, please. This is a quick snapshot of who LA Best Babies Network is. Again, LA Best Babies Network, or I'll refer to as LABBN. We are the oversight entity for home visiting programs that are funded in LA County. I'll go more into the details, but we are part of the Community Benefit Department at California Hospital, which is a Dignity Health hospital located in the core of downtown Los Angeles. If you're familiar with the area, we're just a couple blocks away from Staples Center. California Hospital actually started out of First 5 LA, First 5 Los Angeles. Initially, when it was started, it was meant to be a community project for a few years that would better focus on the 0 to 3 population. But because of our success, we just continue to grow and get more grants and really just build a stronger presence in the community. And in 2009, we piloted the first Welcome Baby Universal Home Visiting Program in LA County. Welcome Baby is a light touch model. It sees families prenatally up until 9 months postpartum for either in home or over the phone, now virtually given COVID. And we've just continued to expand after that, after the success of the pilot. In 2013 and 2015, we expanded to 14 hospitals and 26 community-based organizations. And in 2019, we expanded funding sources and expanded slots for our models as well, which I'll go into a little bit more detail in a bit. We have a few main funding sources in LA County in terms of funding home visiting. First 5 Los Angeles, the Department of Mental Health, Department of Public Health, Department of Public Social Services, the Department of Human Services, and state funding, California Home Visiting Program dollars. These are the main sources of home visiting funding within our county. Our network, our home visiting services, see over 17,000 families per year. Depending on their risk factor, they're in various models. Our network, which we call Family Strengthening Network, has over 700 staff. Again, we have 14 hospitals and 26 community-based organizations that are part of this network. We're all using the same data system. All staff are required to go through the same training. We provide technical assistance to all these organizations and teams. And essentially, there's 4 main models that we provide support to. We provide support to the Welcome Baby program, Healthy Families America, Parents as Teachers, and Mama's Neighborhood. Some logistics around LABBN. We have 18 full-time staff, and we're divided into a few main departments, which I'll mention in a little bit. But we do a lot of work around training, technical assistance, data management, and CQI, continuous quality improvement, communications management, which includes branding and marketing in a standardized way across the county, and standardization within models and across all funding sources, which is a huge task, but one I think we've done very successfully. making sure that we're able to meet not only the model needs, but our sites who are receiving funding from various sources are also have standardization across those funding sources. LABBN is also proud to convene, facilitate, and coordinate the LA County Perinatal and Early Childhood Home Visitation Consortium, which we for short call the consortium. There's our 63 home visiting providers, maternal and child health organizations, advocacy groups, and funders that take part of this larger consortium, which you'll hear more about in a little bit. Next slide, please. A little bit more information about what LABBN exactly does. We are broken down into 5 main teams: our technical assistance team, our training team, data team, communications, and policy. And you'll notice there that policy houses the consortium, which you'll hear more about. Our training team supports parents and families, making sure that we have a well-trained workforce. Before any home visitor sees families, we make sure that they have in-depth training on a wide range of topics. We coordinate and facilitate the training throughout the year, and then follow up by offering continuing education and peer-to-peer learning and collaboration. For our training, for our technical assistance team, we provide oversight. We keep our network on track, conducting audits and providing technical assistance to ensure each team meets the requirements of funders and their national program models. We also produce and maintain protocols and host regular meetings for each role so duties and expectations are clear. For our data team, we provide the infrastructure to fulfill requirements for data collection and confidentiality. We provide rigorous analysis and reporting, and also bring data to life so it can guide our relentless pursuit for continuous quality improvement. For our communications and outreach team, we guide and support outreach teams, helping them raise awareness and recruit clients. From custom marketing materials to blogs to social media posts and tools for online referrals, we provide organizations what they need to enroll families, and also share the latest information and relevant resources. And last but not least, our policy and advocacy team. Our advocacy efforts shine a light on how home visiting investments pay off for families and communities. We also keep our network apprised of local, state, and federal policy changes and how they may affect their work. By overseeing the consortium, we're uniquely positioned to lead and partner with home visiting programs across LA County. Next slide, please. Just to share some photos when we were more in person, if you will. Again, our collaborative network consists of 14 hospitals, 26 community-based organizations. Our network sees over 17,000 clients yearly. We have nearly 750 staff. That staff comprised of home visitors, nurses, administrative and data support staff, outreach staff, managers and supervisors, and clinical supervisors. It's really, again, important to note the standardization across the models while meeting funder needs and model needs. And the really unique piece about the network is the standardized database management system that we use, along with the branding and marketing and staff training that we have. Again, our strong technical assistance needs and assessment and response also allows us to better meet the needs of our home visiting clients and consumers. And of course, the work of the consortium is dynamic. The idea is that we're in the center of the county. We're able to leverage our partnerships and have thoughtful collaborative work that moves forward, all with the vision of home visiting and better serving our clients. Next slide, please. Just the visual here. Again, what county agencies are currently investing in home visiting? First Five Los Angeles funds Welcome Baby, Healthy Families America, and Parents and Teachers. As a reminder, Welcome Baby is the universal home visiting program in LA County that was birthed, if you will, by First Five LA with their support in 2009. The Department of Public Health funds Nurse Family Partnership and Healthy Families America. The Department of Mental Health also funds Nurse Family Partnerships and Healthy Family America. The Department of Children and Family Services, PFF, that's our DCFS, they fund the PFF program, and which stands for Partnerships for Families. The LA County Office of Education funds the Early Head Start program, and state dollars, California Home Visiting Program dollars, fund our Parents as Teachers program. So that is a little bit about the home visiting landscape in LA County, along with some background of LA Best Babies Network. So with that, I'm going to pass it on to my colleague, Jana Wright, our Director of Policy, to talk more about the consortium. Thank you.
Hi, everyone. My name is Jana Wright. I'm the Director of Policy at LA Best Babies Network and the coordinator of the Los Angeles County Perinatal and Early Childhood Home Visitation Consortium, which I'll be referring to as the consortium throughout the rest of the presentation. So a little bit on the consortium. So it started back in 2012, and the LA County Perinatal and Early Childhood Home Visitation Consortium evolved out of a Perinatal Home Visitation Advisory Committee that had been convened in 2010 by the Los Angeles County Department of Public Health. This was convened because they were trying to figure out how we were going to apply for dollars made available through the ACA. And through the ACA, as you're probably all aware, the federal government created the Maternal, Infant, and Early Childhood Home Visitation, or MICV, grant program to invest $1.5 billion in quality home visiting programs, and this has been extended. They've extended this investment twice since 2010. So participating agencies in the advisory committee recognize the value of and need for a body that could give voice to important issues, advocate on behalf of collective concerns, and work together to develop needed cross-county data tracking mechanisms and peer resources in support of high-quality services. With the sponsorship of First 5 LA and the co-leadership of the Department of Public Health and LABBN, the consortium was born. Today, it exists as a network of approximately 50 perinatal and early childhood home visitation programs, maternal and child health organizations, advocacy groups, and stakeholders. Together, we work to support LA County's home visitation program by sharing training and educational resources, researching best practice standards, supporting enhanced referral systems between programs, conducting research and collecting data on home visiting outcomes, as well as advocating for systems and policies that recognize the tremendous value of home visitation services. And we're also funded by First 5 LA and LA Partnership for Early Childhood Investment. Next slide, please. So the mission of the consortium is to coordinate, measure, and advocate for high-quality home-based support to strengthen all expectant and parenting families so that the children of Los Angeles County are healthy, safe, and ready to learn. And our vision is that all expectant and parenting families in Los Angeles County have access to quality in-home support delivered by well-trained, culturally sensitive individuals to promote optimum health, safety, and child development, as well as strengthen family functioning, resiliency, and self-sufficiency. Next slide, please. Like I was saying earlier, the consortium has over 50 member organizations such as Antelope Valley Partners for Health, Child Care Resource Center in the Antelope Valley, Breastfeed LA, Alneda Family Centers, Children Now, Child Development Institute, LA Care Health Plans, a managed care plan in Los Angeles, LA Partnership for Early Childhood Investment, LABBN, of course, Foothill Family Services, the Department of Public Health, First 5 LA, and PHFE WIC. So coordinating the consortium with partners from all these different backgrounds, multiple levels of staff and education can be challenging. It's important, though, to keep a pulse on what is happening on the ground. We do this during monthly work group meetings, which I'll explain more in a minute, by asking what they are seeing in the field or hearing from the field. It's important to be inclusive in efforts and ensure that all members feel that their voice is heard. The consortium emphasizes collaboration over competition. This can be difficult when sites may be competing for the same dollars, however. Staying true to our vision, we have created a home visiting system in which referrals are actively made to other programs depending on the needs of the family. Next slide, please. So currently the consortium has 5 work groups. The first is the referrals work group, the best practices work group, the data work group, the advocacy work group, and finally the African American engagement work group. And then the consortium coordinating committee consists of all the co-leads, which there are 2 for each work group, and they make the decisions for the consortium. Next slide, please. So in 2014, the consortium commenced a full strategic planning process in order to solidify members' common vision and create measurable, actionable goals to focus its work in the coming years. The referrals work group took on the first goal, which is to build working referral pathways among programs. The best practices work group took on the second, which is to promote well-trained and supported home visitors. The third is the data work group's goal to collect data to understand, support, and demonstrate collective impact. And the advocacy work group has the 4th and 5th goals to elevate, promote, and advocate for quality home visiting and to increase funding and partnerships. The 6th goal to self-govern effectively and impactfully is for all work groups. So the African American Engagement Work Group was added to the consortium in October of 2020 and has not developed formal strategic goals yet. I want to point out that while it is important to have strategic plans with the defined goals, objectives, and corresponding activities, it is equally important to build flexibility into the plan in order to be responsive to the needs of the home visiting frontline staff in the community, which is a lesson we definitely learned in 2020 because of the COVID-19 pandemic. And now Sharlene will talk more in depth about the African engagement work group.
Thank you, Jana. The birth story of the African American Engagement Work Group is actually one that's near and dear to my heart, because the beauty of this story is that it started by the same folks that are doing the work. It started with the home visitors, the managers, and the supervisors. It's community driven, and it's gone through a process the last couple of years before formally coming under the consortium. First and foremost, it was the identification of the problem. We needed to know what was happening. We know that the root cause is toxic stress caused by racism, which has a weathering effect on the body. We looked at data, we called in parent panels and so on and so forth, and identified what we already knew, but we just needed to solidify for the moms and families that were in our programs, were Black babies are dying 2 to 3 times at the rate of white babies, and Black mothers are dying 3 to 4 times at the rate of white mothers. We then needed to talk about the importance of timing. When we started back in 2018, timing was everything, because there was an opportunity to expand home visiting, which did happen in 2019. DPH, Department of Public Health and Partners, were focused on reducing infant and maternal disparities by 30% in 5 years. As a county, like I said, we were expanding home visiting programs, and the state budget included nearly $45 million to further expand home visiting services across the state. The beauty of home visiting and this work is that we know that home visiting works, that if you have high quality programs, in fact, you can make a difference in these families' lives. Next slide, please. As the African American Engagement Work Group started to expand, we realized that regardless of what role the person was in when they were taking part in the meeting, we all had a role in this larger picture. We were just looking at it differently. Home visitors and nurses and clinical supervisors, managers, data staff, everyone brought their own perspective and their own expertise to the meeting and to what was happening here. The beauty, again, of this work group is that it's driven by the home visitors themselves. The majority of the participants are the folks that are doing the work themselves. It is not necessarily top heavy, as I like to call it. We did a lot of research the first couple of years. We did data reviews. We looked at our own enrollment, retention, and completion outcomes. We had focus groups and parent panels. We had focus groups with staff. We had focus group with parents. We invited parents to come in and tell us what worked and what didn't work with home visiting. What terms did they like? What terms did they not like? What caused them to trust someone and not to trust someone, or access a resource or not access a resource? We did some heavy surveying and interviewing of staff, trying to determine our own staff demographics and why perhaps we weren't seeing more diversity within our own workforce, what we needed to do differently. After a heavy analysis, we also came up with recommendations as well. The other big piece about this is the open and safe space for free-flowing discussion and exchange of ideas. The work group was one that was very unique for our network, as it was one of the first places to allow space for our home visitors to talk about these successes and challenges they were having with African American families. They themselves had seen the work, the challenges on their own site level, but didn't necessarily realize that it was a problem that existed on a larger level. And the opportunity to exchange ideas, exchange data, but also analyze and come up with recommendations was motivating. What it also brought up for us was the need for programmatic modifications. Were we doing things the best way possible to recruit, enroll, and retain these families? We needed improvement in recruitment and retention of African American families. We needed to revisit our eligibility and enrollment criteria process, and even our timeline. We needed to consider phone and virtual visits, which eventually became a very easy change given COVID. And we needed to create more group opportunities, more opportunities between the parents themselves to feel support, sustainable support in the long run. Our hiring best practices needed to diversify. When we started off, we had very strict hiring practices, but perhaps some of those things were also the reasons why we weren't able to diversify our hiring methods. So talking more about that. Training needs. The work group talked about implicit bias and cultural competence. Cultural competence has always been an integral foundational basis of the training of any staff who goes out and sees clients. We needed to do more around self-awareness and implicit bias. And you'll hear more about that a little bit later when our technical assistance team talks about it. And then outreach and marketing. We needed to have tailored strategies. We needed to have marketing and messaging in very specific outlets. We need to reconsider our own language that could be triggering for the families we were serving. And with that, I'll pass it back on to Jana to talk about the African American Engagement Work Group and where it stands today. Thank you.
Thank you, Sharlene. So today, the African American Work Group exists as part of the consortium. And like I said earlier, it formally joined the consortium back in October of 2020. The work group is focused on increasing African American home visiting staff and engagement of African American families. Some gaps that have been identified since October 2020 have included hiring practices. So specifically working on some standardized language for job postings, as well as the exclusion of the bilingual requirement, partnering with HBCUs for recruitment of home visitors, future home visitors, and some best practices for funders as well. We've also talked about marketing materials, making sure they build off of the data that was previously collected through parent panels and focus groups to make sure that those materials are suitable for the community being served. And then also implementing annual refreshers of implicit bias training. We really seek to create a brave space for African American home visiting staff in this work group. In our brave space, where we have breakout rooms as well as larger group discussions to make sure that we're keeping a pulse on what's going on in the field and addressing any issues as they come up. Next slide, please. Excuse me. So I want to talk more specifically about what the consortium has done as far as addressing racism and filling any gaps in knowledge of consortium member organizations. So the Best Practices Work Group has an annual survey that's disseminated called the Annual Training Survey. This was disseminated back in June of 2020. So the purpose of this survey is to learn more about home visitors' training needs and to support ongoing efforts to facilitate collaboration among home visitation programs. This is also used to select topics for upcoming trainings and webinars that the consortium supports. So we had 143 respondents. Of those 143, we had 81 home visitors and then 40 program managers, including directors, managers, supervisors, and coordinators. Next slide, please. So of all the respondents, 53% identified anti-racism as a gap in training. Of all of the home visitors, 52% identified anti-racism as a gap in training. And of all managers, we had 55% identify anti-racism as a gap in training. Next slide, please. So this slide has a visual of some of the information gathered from the annual training survey. So this is a percentage of managers identifying training need. So the top ones were establishing and maintaining healthy boundaries at 68%, physical or mental health emergencies 60%, working with father/fatherhood engagement 60%, working with a parent who has mental health challenges at 55%, and then tied with that is anti-racism at 55%. Next slide, please. And as a response to this, we hosted the If Mama Ain't Happy webinar series on perinatal mood and anxiety disorders in collaboration with Maternal Mental Health Now. This was a series of webinars offered in both English and Spanish. This included information on racial trauma, toxic stress, and mental health. We have identified in home visiting that several of the clients and families have identified stressors such as community violence and racism and their effects on their personal mental health. We created this webinar series in order to address some of the things going on. So we're also exploring how to address anti-racism training gap as identified by the consortium-wide survey. So racial injustice and trauma has been an issue that's come up as far as a gap in knowledge. We're looking at hosting a webinar series on historical events leading to today's events, particularly around the Black Lives Matter movement, and then effects on the African American community. Also looking at including a webinar on racism and toxic stress and the biological effects as well. And now Kayla is going to talk about the technical assistance efforts of LABBN. Thank you.
Thank you, Jana. My name is Kayla Kakavand. I'm one of the Public Health Research Associates, and I'm a part of the Technical Assistance team. As mentioned, LABBN's TA team coordinates technical assistance for our network of program managers and supervisors across all three home visiting models, HFA, PAT, and Welcome Baby. Listed on this slide are some of the different ways in which we support programmatic outcomes and best practices and provide TA to program leads. Each of the items listed on the right-hand side of this slide allow the LABBN TA team to identify, integrate, and evaluate needs. This includes monthly site updates, which are required from Welcome Baby and home visiting sites, and provide LABBN with site updates, topics of need for upcoming trainings and meetings, and if there are any requests for additional support, site audits, manager meetings, specific TA webinars, reflective practice sessions, and evaluation reports, which are collected after trainings to assess whether needs were met and how we can shape future trainings. For home visitors to support parents and families, home visiting staff are required to participate in a cohort training series. The LABBN training team coordinates and facilitates a comprehensive training curriculum for a network of over 800 welcome baby, HFA, and PAT home visiting program managers and staff across LA County. One of the required trainings within the cohort training curriculum is the cultural competency training. During this training, staff members learn about the conceptual framework of cultural competency, learn the rationale for cultural competency, and demonstrate the skills that enhance cultural competency in home visitation. These learning objectives are supported using a specified learning curriculum, case vignettes, videos, and open forums for discussion amongst peers. The goal of the cultural competency training, along with other required cohort trainings, is to emphasize that these objectives are not taught, but rather obtained and learned through a parallel process. The parallel process is done by modeling skills to home visitors, who in turn practice and model with their families and clients. The implicit bias regional trainings were incorporated by LABBN when a need was expressed by the African American Engagement Work Group. This is when it was housed within the network only, which included HFA, PAT, and Welcome Baby. When the group came together, they discussed that there needed to be more than just cultural competency and more trainings on implicit bias. So as a result, LABBN was given extra funding to produce this in 2019. So LABBN hired Dr. Barbara Stroud, a licensed psychologist, trainer, and consultant with over 3 decades of culturally informed clinical practice and training in early childhood development and mental health arenas as a consultant. And she provided 6 full-day trainings that took place in September 2019 for home visiting staff and 2 for managers and supervisors. 4 full-day training webinars were provided in July 2020. And this image here is part of our 12 follow-up implicit bias trainings that are taking place in 2021. And this also includes 4 for managers and supervisors. Dr. Stroud helped provide and create a safe space to foster thoughtful thinking and reflection, and participants in attendance focused on identifying elements that impact culture other than race, building reflective practice skills that support successful relationship building with culturally diverse families, and outline the neurological mechanisms that erode psychological integrity through ongoing exposure to the toxic stress of racism and demonstration. The implicit bias regional trainings for managers and supervisors focused on creating co-regulation within the supervision experience to explore social injustice, racism, inequity, and discrimination for the families served, as well as home visiting staff, using reflective skills to hold multiple layers of a family's trauma while co-regulating the home visiting staff, thoughtfully examining the concept of white fragility from a curious stance versus a defensive stance, outlining elements of privilege within the infant mental health professional community and service delivery systems, and defining systemic racism to their professional community as a method to increase professional understanding of system-level inequities. The goal was for attendees of the staff and supervisor regionals to leave with a better understanding of the ways health and mental health systems are influenced by dominant culture biases and how reflective practice skills support successful relationship building with culturally diverse families. Now I'm going to go ahead and pass it on to my colleague, Martha.
Thank you, Kayla. Hi, everybody. My name is Martha Bock, and I work on the LABBN Technical Assistance team alongside Kayla. And I'm going to discuss a few more of the ways that LABBN supported the program leads with their requests to address racism, implicit bias, and cultural competency in their programs. So as mentioned before, the LABBN TA team provides the programmatic guidance and support based on the needs that are expressed by our network. One of the ways that we do this is by locating resources, written guides, and links to community events or webinars on the topics that the leads have identified as a need. I compile these resources into a weekly TA email, which is then sent out to all the program leads within our network. LABBN also maintains an online blog with links to resources that can be accessed by the leads at any time. As a response to the needs expressed, we located news articles, resources, and books about how to talk to kids and families about race and racism. We also shared webinars on historical trauma, health disparities, and the impact of racism on health. Leads were then encouraged to share these with their staff and integrate the findings into their own programs, and we supported them with this integration process through some of the methods that I will discuss next. Next slide, please. One way that we supported the leads in integrating information about race and implicit bias in their work was through the provision of webinars and small group consult sessions with content experts. When we received a lot of requests for sessions that address race and equity, I secured content experts to address these topics and then facilitated the events for our network. One of these was a webinar with Dr. Angelique Anderson of the Solano County Healthy Families America program titled Historical Framework on Traditional African American Parenting. This webinar explored the historical roots of parenting styles prevalent in the African American community. The hope is that this knowledge will translate into a better relationship between home visitors and their African American clients, which we hope will ultimately improve the outcomes for these clients and make them feel more welcome in our home visiting programs. The other TA session will happen in April, and it's a consult session with Yolanda Rogers-Jones, a former program manager of the LA County Black Infant Health Program. This session is centered on how to have difficult conversations about race with your staff, and this will be open to managers only. Next slide, please. We also host 2 monthly meetings, one for Welcome Baby program managers and one for Healthy Families America and Parents as Teachers program managers. These are spaces of peer gathering and sharing, and the purpose is to get all the program managers together to discuss specific successes, challenges, and strategies in the interest of continuous improvement. I facilitate these 2 meetings once a month, and I set the agenda based on the topics that the leads have identified as in need. So as you can probably imagine, in June and July of 2020, we had a lot of requests to address strategies for supporting staff during difficult times, and primarily strategies for having open and honest dialogue about racism in America. So to address this, we used the breakout rooms on Zoom to create small groups and then ask leads to discuss their strategies for supporting their staff. And then we brought them all back into the big group to share what they had discussed. In this way, the leads were able to hear from others about what was working and get new ideas about what they could do with their staff. We also hosted a continuous quality improvement discussion about engagement of African American clients in September. We presented data on how the programs were each doing with regards to African American client engagement. We then provided tips and resources for ways to improve this measure and help them set realistic program goals moving forward. Finally, we're hosting in April a demonstration of the racial wealth gap simulation at the manager meetings. This simulation comes from the Bread for World Institute, and it highlights the connection between 13 federal policies and some of the structural inequities that are prevalent among African American communities today. Our goal is to demonstrate this with the program leads as an example of a tool that they can use with their staff, teach about health disparities, and then start those hard conversations about how to serve communities who are inequitably burdened. Next slide, please. Another role of the TA team is to facilitate reflective practice groups with the program leads. We host 7 groups of about 15 program leads. Each group meets once a month for 2 hours. LABBN has a consultant who is a licensed mental health professional who leads these groups and explores the reactions and feelings of the leads that come up during the course of their work in home visiting. Race and racial equity was discussed at a lot of the meetings in 2020. The facilitator often started each group by introducing a resource. Sometimes it was a Brene Brown podcast episode, sometimes an article, sometimes a journaling activity, something that got the conversation going. And the leads were then given the time to reflect on their thoughts and feelings and how these related to their work in the community. This portion of our TA response was really important. Our goal with these groups was to create a space where the leads could have these hard conversations with each other and give them an example of how to implement this with their own staff. Next slide, please. Finally, I conduct an annual audit of every Welcome Baby site. I have specific programmatic objectives that I assess through data reports, and then we meet with the leadership at each site to review these measures and get qualitative feedback. At these meetings, we assess the site's yearly progress, troubleshoot any challenges that the sites are facing, and we set goals for the next fiscal year. This year, I've created an audit tool to help assess for diversity of staff and engagement and retention of African American clients. And this won't be a punitive tool, but will serve as a baseline measure for assessing where sites are at now and get the program leads thinking about how to improve these measures over time. Quantitative measures I will be looking at through the data reports include African American enrollment, client retention rate, missed visit rate, and overall program completion. And then I'll use some qualitative questions to engage in a conversation about goals moving forward and how we can better serve the African American families in our community. This process will be repeated every year so that we can get a better sense of the progress being made at each Welcome Baby site through our efforts. And now I will pass it back to Kayla to discuss the final way that we supported the program staff with this need.
Thank you, Martha. Every year, LABBN hosts an annual summit with the purpose of celebrating home visitors and the work that they do. During July 2020, due to the COVID-19 pandemic, we decided to move our annual summit to a virtual platform as this event is too important and one that our network really looks forward to. During this, the time of this summit over the summer of 2020, LA County and the nation were at the height of political unrest and the Black Lives Matter protests. The keynote speaker during the summit was Dr. Jana, who shared a compassionate and healing message in celebration and support of staff. Attendees left the summit feeling confident in their ability to highlight who we serve, gaining a richer understanding of how home visiting benefits families, feeling supported for exhaustion and trauma as they support and nurture families through their own trauma and feelings of unsafety and vulnerability during the pandemic and racial and social revolution, and feeling confident examining the new opportunities programs and providers face in using home visiting to build an anti-racist support system for all new parents. And now I'm going to pass it to our director, Sharlene.
Thanks so much, Kayla. Here we are at our last slide, or almost our last slide, but wanted to go through some lessons learned and continue the conversation. If there was anything to take away for today, I hope what you're able to take away is that you have to start somewhere. All this work happened because we created a space for our home visitors, our managers, and even our families to discuss what they needed. The next piece was supportive funders, the ability to go to our funders and make a concrete ask, asking for a certain amount of dollar amounts to provide a certain support system that would ensure us a certain outcome. Active oversight to integrate these strategies. What you've heard today is the LA Best Babies Network team is heavily involved in providing this support and helping the sites integrate these strategies into their day-to-day work. These trainings are not just about, hey, we've got an hour and a half space, let's talk about it, or you have a full day training, but they're meant to be conversations that start the ongoing and day-to-day integration of this work into daily tasks. Ultimately, we need to hold the space for our clients in order, or I should say, we should be able to hold the space for our staff so they could do the same with the clients as well. This is a continual conversation. There needs to be space created for ongoing, safe, creative ways of thinking and talking about things that come up. 2020 was an unprecedented year for all of us. There was a lot of uncertainty, a lot of social injustice just piling on top of one another. Those types of things need to be talked about and processed with staff because we know the staff is doing the same with families. So creating that space and continuing that conversation is huge. We wanted to also take some of the burden and the weight off of the staff that's in the field. They already do so much. They're constantly providing to our families. They're constantly providing to their own families. And on top of that, the pandemic with COVID and so on and so forth, transitions constantly to virtual and so on and so forth. LABBN wanted to take on the responsibility of carrying the weight of some of all of this and be able to provide the families and the network with that space. Again, this is a parallel process. The expectation of how we expect our staff to work with families, we do the same thing with our staff. And ultimately, it's about the outcome of work for these families in LA County. We know that there are residual effects of maternal stress on an infant. Even at birth, if the infant comes out okay, we know that residual effects lead to chronic disease of those infants down the line. And we know that our African-American families have a much higher rate of chronic disease. The question ultimately comes down to is how can we impact this? How can we make a change? How can we decrease these statistics and increase self-efficacy, confidence, and so on and so forth? How do we continue to have these conversations and be able to model these behaviors for our leads who ultimately do that for the families? So with that, I hope you have taken away some concrete things from this presentation. As you heard, there's a lot of work that goes into this. Again, I think having an oversight such as ourselves is really helpful because we can carry some of the weight for these agencies and staff. But before we leave today, I also wanted to go to the next slide and share some resources that LABBN and the consortium have that you can use. Highly suggest that everyone follows us on Twitter. Check out our Stronger Families blog. It has a bunch of resources for families and for home visitors, even has a COVID-19 specific page. Check out our consortium homepage. You've got a lot of good information, including the e-directory for LA County home visiting programs. Anyone can log on there and find a home visiting program that meets their needs through that e-directory. The consortium homepage also has a great data-driven webpage. You can download a lot of stats and reports and infographics and all sorts of things like that. And of course, lastly, the First Lab LA, our funders page as well, lots of good information and updates around policy and advocacy there as well. And the last slide to share is our contact information. Really appreciate everyone taking the time to join us today during all the craziness. I know we're all very busy, but hopefully you're able to take away information and concrete things that you can integrate into your own work. And as always, feel free to reach out to any of us, all of us, and we'd be happy to answer any questions. And with that, we are concluded with our presentation. Thank you so much, everyone.